first, the big issue of the day, lockdowns. The burning debate continues to rage. In a moment, I'm going to talk to Toby Young. He's the General Secretary of the Free Speech Union, and I think very much the face of lockdown skeptics, runs a website called Lockdown Skeptics. He will put the case for at least being skeptical about whether or not this form of action against the coronavirus is effective. Does it do more harm than good? We'll hear from him in a second. But first, let's talk to Dr Bharat Pankhania. He's Senior Clinical Lecturer at the University of Exeter Medical School, who I hope is going to put out the case for lockdowns. Good evening, Bharat.
Hello, good evening to you. Good evening, everyone.
Thank you for coming on to the show. Now, as I said in my intro just now, looking around us, Bharat, we have a record number of deaths, record number of cases. The NHS is on the point of being overwhelmed. This comes at the end of 10 months of various lockdowns, 3 months worth of them in the summer, another one all over the country in November. Don't forget there was that full Welsh fire break in October, and then with a strict tier system in December. We have basically been off and on in almost constant lockdown for 10 months. Look around us, it looks like a disaster. Surely skepticism about the effectiveness of these measures is not only inoffensive, it's logical.
Yes, so I would say we haven't done it properly, and if you don't do your homework properly, it will never work. So if you're trying to build an aeroplane and you still carry on fudging it, it will never be aerodynamically stable. No matter what you do, it will never be aerodynamically stable. Using that same analogy here, we went into a late lockdown and we came out of the lockdown early. Then we had to go into another lockdown. Again, we came out of it early, and schools, colleges, universities, and other trades continued to operate. We've now gone into the third lockdown. And whilst I know, because I study this every day, that the third lockdown has immediately shown its positivity of reducing case numbers. Within a couple of weeks, I can see the case numbers coming down. It will only work if you are serious about having a hard, fast, early shutdown, remove person-to-person interactions, and then get on top of the infection. What we are doing is harming health and harming the economy because we don't do it properly from the beginning. That is the big issue. It's not lockdown that is bad. It is a poorly conducted, poorly executed lockdown that is harmful.
And are you talking there about compliance? Because recent figures have revealed that 96% of Brits are obeying the rules of the lockdown and always have. And in fact, compliance levels are going up and up and up. You cannot, as a government, make a plan that relies on 100% obedience from everyone. That's bizarre and ridiculous. You won't ever get that. You've got about as much compliance as you ever could get. So we cannot just blame the rule breakers for these lockdowns not working, can we?
Well, no. let me contribute. So it is multifaceted. So when you have interactions with humans, there is always a weakness in the chain. There's a weakness in the link. So when you have people commuting on buses, on trains, going to cafes, going to schools, universities, all those human-to-human interactions equals spread of infection. So you can comply as well as you wish to. However, if there are weaknesses in the chain, infections will happen despite complying. One more thing, unfortunately, we have lost control by allowing our case numbers to shoot up, and having had our case numbers shoot up, and then of course there was the unfortunate thing of the new variant is much more infectious. But I counter back what Prime Minister Johnson said, which is it's all the fault of the new variant. It isn't all the fault of the new variant. It is also the fault of you allow infections to occur. And if infections occur, a new variant will catch you easily. So it's all those multifaceted things. Unfortunately, the bottom line is this, The greater the number of human-to-human interactions, the greater the chances of getting infected, and then the rest is consequences that we know of.
As a physician, we're going to go over to Toby in a second, Bharat, but as a physician, do you not worry that the effect of lockdowns, and as you propose, an even stricter lockdown, will have massive medical ramifications in terms, we now know that there are more than 4 million people waiting for appointments at the NHS, waiting for surgery for non-urgent conditions. We've heard of thousands of people dying, not necessarily the NHS's fault, but they've been scared to go to hospitals. We have mental health issues spiralling. Only today we hear that many school children are suffering mental health issues. We've heard of suicide rates going up, and of course the economy crashing is going to cause untold problems, not only culturally and socially but medically. Do you not worry about the effect of that when you call for total lockdowns, because they do have very, very destructive effects elsewhere?
You are answering my questions for me. So because I want everyone to be able to be treated for their heart attack, for their stroke, for their broken hip, for all those things that we do in the National Health Service. That is why we need to have the case numbers for SARS-CoV-2 infections controlled and brought down. Because if we do not bring down the case numbers for SARS-CoV-2 and everyone is admitted to hospital, or many people are, then we lose the capacity to treat the heart attacks, the strokes, the fractured hips, etc. So I'm with you. Of course, we want to treat. But what I am saying is when the hospitals get overwhelmed because you've got the beds taken up by people with COVID-19 disease, then unfortunately, which is something our politicians find it difficult to spell out, I will, on behalf of our listeners, is people will die. So people from heart attacks, their strokes, their fractured hips, etc., will die, and they need not have died, and they will die because the hospital is full. So I'm with you that I don't want these things to happen. And one way to not allow them to happen is reduce human-to-human contact in the middle of a crisis. We are where we are. We didn't do it properly. And what can you do, right? The vaccines are being rolled out, but we mismanaged it. So in the middle of a mismanagement, I don't want to say all bets are off. I want to say, let us regain control so that the heart attacks, the fractured hips, the strokes, etc., the aortic aneurysms can also be treated.
Thank you, Bharat. We'll come back to you in a second. Let's go over to Toby Young, General Secretary of the Free Speech Union, and a man who assiduously records the case for lockdown skepticism on his website, Lockdown Skeptics. Good evening, Toby.
Good evening, Kevin.
Do you agree that lockdowns would work if we'd done them properly, as Bharat says? He says we haven't done them properly. Do you think there is a case for saying if they were stricter at the beginning, if they were stricter now, that maybe they would work? Or is there an argument against lockdowns altogether?
No, there isn't much evidence that lockdowns are effective at reducing the overall number of deaths from COVID-19. So if you look at the international evidence, if you look at the ways in which lockdowns have been imposed across the world, the timing of those lockdowns, the severity of those lockdowns, there doesn't seem to be any relationship between those variables and the number of people who succumb to COVID-19. I mean, just to give you a couple of examples, Sweden, as we know, famously didn't lock down last spring, had fewer deaths per million in that period than many European countries which did lock down, such as France, Spain, the United Kingdom. If we look at countries which did lock down hard, I believe that Peru has had the most severe lockdown in the world. It also has the highest number of deaths per million from COVID-19. If we compare US states that shut down to those that didn't, there doesn't seem to be any evidence that those that shut down have fewer deaths per million than those that did. So internationally, there doesn't seem to be much evidence that lockdowns work. Turning to the United Kingdom, turning to England and the present lockdown, Boris is now claiming, as you said in your introduction, that the third lockdown has been effective in reducing the number of infections and hospital admissions. Well, that's true it's true that the number of infections in London East England and the Southeast have been declining. But that decline, if you look at the Zoe app data, the data compiled by Tim Spector at King's College London, which I think is generally held to be pretty reliable, that infections in London and the southeast started falling around about the end of December, so before the lockdown was imposed on January the 6th. And in other parts of the country, such as Midlands and the Northwest, infections and COVID admissions are still increasing in spite of the lockdown. And that's not because people are more compliant in London and the southeast than they are in the Midlands and the Northwest. It's just that lockdowns don't appear to make a huge impact on the spread of this virus. It seems to ebb and flow to the beat of its own drum. But we do know, Kevin, I think what is incontestable is that lockdowns cause immense harm. They cause harm to children's education. They cause harm to people's mental health. They cause catastrophic harm to the economy, particularly those sectors that depend on retail, like the hospitality sector, non-essential shops, and so forth. So there's no debate, I don't think, about the immense harm that lockdowns are causing, not just to the economy, but to public health as well. But there is, I think, a great deal of uncertainty about just how effective lockdowns are. So as you say, to continue to pursue this policy as the only effective way of controlling the virus, given that it hasn't worked, and we've tried it now 3 times, this is the 3rd time we're trying it, it does seem crazy. It seems like Einstein's definition of insanity, to keep doing the same thing and hoping for a different result. I think it's time we rethought how to reduce overall COVID mortality. And I think the recommendation of the authors of the Great Barrington Declaration, which is focused protection, protecting the elderly and the vulnerable, those who do have a high infection fatality rate from this disease, but letting those who don't, the under 70s, who don't have any underlying health conditions, just get on with their lives as normal.
Why is it that people like you are being almost compared to the devil himself at the moment? To be sceptical about the effect of lockdowns is first of all, in my view, outrageously being conflated with being a COVID denier. To doubt the effectiveness of lockdowns is not to deny COVID. That would be ridiculous. People accuse me of it. I've had COVID, so how can I deny it? It's ridiculous. But what is it about lockdown skepticism that seems to be getting everybody so worked up at the moment? Is it that we look to the government, we want our government to be able to do something about this, we want to yearn for effective measures, and somehow or other we demand that they will be effective even though it doesn't seem they are being? What is going on here, Toby?
Well, as you say, I think it's important to stress that lockdown skeptics are not COVID deniers. They're not, for the most part, anti-vaxxers. We don't believe in crazy conspiracy theories. We just have a different view about the effectiveness of lockdowns to those who advocate for them. And I think there's quite a lot of evidence you can marshal in support of our view. Admittedly, there is evidence on the other side too. It's an important ongoing scientific debate. It hasn't been settled. There isn't such a thing as the science, which says that lockdowns work and we have to try them as often as possible. Why are people demonizing lockdown skeptics? I think a lot of the criticisms I hear are based on the assumption that lockdowns work. If you think lockdowns are effective and that they are reducing overall COVID mortality, then you're going to be quite hostile towards people who say they don't work, because you're going to say that, well, if the public hear you saying that, they're going to be less compliant, and that's going to result in a higher overall COVID death toll. But if you dispute that assumption, if your starting point is that actually lockdowns cause more harm than the harm they prevent, then from our point of view, those who are passionately advocating for lockdowns are actually causing harm, not us. I don't think you can start by assuming the debate has been settled and then criticize one side because they don't agree with you and they're contributing to the death toll. The fact is that the debate is ongoing. And until we've resolved that debate, until we have a clearer understanding both of the virus and the best way to control it, it seems to me that you shouldn't suppress either side in that debate. It's an important debate that we should continue to have. I think psychologically, I think people are, understandably anxious about the high daily death tolls. They're terrified of getting COVID themselves, like you. I've had it, Kevin. I didn't have a particularly bad bout of it, but it wasn't at all pleasant. Lasted about 10 days. So like you, I'm not a COVID denier. But I think people are understandably anxious about this, and they desperately want the government to be doing something to try and control it. And I think many people are reluctant to acknowledge that actually the things we've been doing to control it haven't been effective. Lots of people who've made individual sacrifices, people who haven't seen loved ones, who haven't visited elderly relatives in care homes, who didn't have the kind of Christmas they've been looking forward to, who are having to struggle with homeschooling their children, who might be having difficulties with their own mental health. They don't want to think that's all for nothing. They want to believe that they're part of a national effort to try and tackle this crisis. So to tell them that actually lockdowns are ineffective and that your suffering may not have been necessary is never going to go down well.
Yeah, I mean, I want to stress that I am complying with the government regulations. I don't advocate breaking the law or breaking these rules. I do think we should debate just how effective they are, and we are all committed to community safety. Can I come back to you in a minute, Toby, for a final word? If we could go back to Bharat. What do you say for your final word, Bharat, to the possibility that this a bid to beat a virus, first time the human race has done it in such a coordinated global fashion, doesn't seem to be going very well so far? Are we involved in an act of folly, a battle, a war that we cannot win? Is it possible that lockdowns, no matter how strict we get with them, will never work? You can't actually lock everyone into a small cubicle and say you can never come out. So there will always be people out and about. Can we actually stop this virus? Are we involved in a rather arrogant act of folly?
I hope it's not an arrogant act of folly. Before I fully answer your question, can I just address two issues, and I will promise to answer your question as well, which is Sweden pursued the policy that it did, and Sweden themselves will tell you today they got it wrong. Similarly, this Great Barrington Report of sequestrating, meaning pulling out of circulation the elderly, the vulnerable, people from severe illness, and then the rest carry on, doesn't work. That's nonsense. So if you have infections that are spreading in the community, there isn't a second planet where the other vulnerable elderly people are so that they remain protected and never get infected. It doesn't work like that. So those are the two issues. Now, with regards to, are we very arrogant? Yes, I think we have been arrogant. Let me show you why we've been arrogant. We think we can conquer everything. We think we are superior in nature, and that is arrogant of mankind. What we need to do is invest in prevention. And every time I try to raise the prevention subject, it doesn't get purchased because it's not sexy enough. But if you invest billions in preventing the emergence of new viruses, then you will not be spending trillions upon trillions upon trillions of pounds in fighting it once it has emerged. That's the arrogance. The other bit is the feeling of panic. So we've gone into major lockdowns because that's the only measure people know. But I agree with Toby in that unless and until you have virus suppression, right? And in other words, you have very little of it circulating globally, you will keep on getting infections and outbreaks. So what do you do in the middle of a crisis? You take some preventative control measures, which is what we're doing. Unfortunately, they're awful because you have to stay locked up, you have to stay indoors, away from people, and businesses are trashed. And then you wait for the vaccines to come and do its bit. But even the vaccines will not do all of their bit until you adopt the policy of no one is well until everyone is well. So you should be immunizing nationally, but you should be immunizing internationally as well. So look, I don't want to take up too much time.
Yeah, we really are running out of time, Bharat. So
I just want to say we can do better.
Okay, fair point. Toby, back to you for a final comment. Lockdowns forever. Every virus that comes along, we're going to do this. That'll change the face of the planet, won't it?
Yeah, I sincerely hope not, Kevin. Every time the country is placed in lockdown, we're told it won't be for long. So we were told back in March it would be for 3 weeks. It ended up being for, well, until the middle of July. We were told this time that it would only be until mid-February, but now that deadline's beginning to slip. And yesterday, I believe, Professor Neil Ferguson said that he envisaged restrictions continuing to remain in place until the autumn, which is a pretty alarming prospect. And I very sincerely hope that they can begin to be lifted by mid-February at the very latest. Just to address Bharat's point about the practicality of trying to protect the elderly and the vulnerable, I don't think it is particularly impractical. I don't think it's impossible. The NHS, after all, recommends at the moment that elderly and vulnerable people shield until they've had the vaccine. So they acknowledge that it's possible. There was a senior infectious disease specialist at PHE who was asked a couple of days ago by a House of Commons Select Committee what our strategy should be if the vaccines prove to be ineffective. And she effectively said, well, it'll have to be focused protection, protecting the elderly and the vulnerable and letting younger people just get on with their lives. I think the important thing to understand about the lockdown policy, Kevin, is that historically it's never been tried before. It was an innovation that came out of China in January, a totalitarian communist regime. And it was copied by the rest of the world with the encouragement of the World Health Organization, even though the WHO had only a year before said that if we're facing another pandemic, locking down the healthy as well as the sick is not the right strategy. It wasn't recommended in the United Kingdom's pandemic preparedness strategy, which was devised, I think, in 2011 and updated in 2014. They said, no, locking down the healthy, shutting them in their homes, closing schools, closing universities, that's going to have far graver consequences than any virus is likely to have. So it's never been part of a recommended strategy by any public health authorities, never been tried before historically. It was only tried for the first time this year, and it was essentially everyone copying what was done in one of the most totalitarian societies in the world. So I really think it's time we rethought this. It hasn't worked. We need to look much more closely at focus protection.